this is a right revision tympanoplasty transcanal approach in a very narrow canal, because we have you are using a 5 millimeter diameter speculum. Yeah, I drilled the canal anteriorly. The problem here is to see the different landmarks. The previous prosthesis which was used is this one, with a titanium head with a strange shaft coming through, and yeah, the other part of the shaft, which is also very strange, has been bent maybe by the previous surgeon in order to reach the tympanic membrane on one side and the stapes full plate on the other side. So I need to remove this prosthesis, which is not working at all. You see, there is no contact to the foot plate. So I need to dissect it and then remove it and see what I can do. We have the fallopian canal right here. Ok, so we need to now to dissect it. Table en avant, s'il vous plaît. Stop. So I did a little bit. Stop. I did a little bit of a canalplasty, mainly at the anterior part of the canal. All right. Là, pour prévenir que quand même ça. Ah, yeah. Looks like there are two prostheses, by the way. This one plus this one. So I don't know. Very strange. Right. Yeah, I should have removed the previous one, I think. Very strange. I don't think there is any residual malleus. The problem is the bleeding, but I think it's good to show the difficulties that we have when it's bleeding. We just have to wait and be patient with that. It's bleeding also because there is a lot of adherence, yes. The causa is really bad. I think I need to remove this one first.
The first one?
Yeah, the right one. Ok. Non, mais en plus, je pense que c'est la muqueuse qui est comme ça. No, not this time. Donnez-moi un 9, s'il vous plaît. I try to grab the prosthesis with a sucker. Well, there are two prostheses, I said, and both are not working. This very big one. And bend and can't work. This can't work for sure. Yeah. Scissors.
They don't bother finding
Yeah, sure. But it's better to remove it. So many things are the same. But I've seen cases like this, yeah. Yeah. Calmez, s'il vous plaît. So I think I'm very near to be able to remove it, but I think there are still some adherence anteriorly. Un ciseau, s'il vous plaît. Some important, huge adherence. Okay, I think it's fine because I think the shaft is not connected at all to the full plate. Yeah, I can remove that. Very strange, yeah? And this pick is for the cartilage plate, I guess. But, okay, so I remove the first one. And I will then remove the second one. Il y en a deux. Pardon, s'il vous plaît. Lots of adherence in the chair. Ouais. There's a big disease of the mucosa, I think, and this is why it's bleeding so much. Un peu gros là, s'il vous plaît. I'll remove a little bit of blood here, and then I will remove the second prosthesis. This looks strange for me. I didn't see any shaft at the moment. There is a shaft. For sure. Yeah, maybe. But the problem, I cannot remove it unless I can identify the connection with the facial nerve. This is the reason why I don't like titanium too much. When you revise, it's always a problem. Okay, the facial nerve is below that, so this is only fibrous tissue, but you know. Okay, ciseaux. Okay, can remove it now. Pince, s'il vous plaît. Second one. Collection of prostheses there. Both are the same, huh? Both are not working. Calmez, s'il vous plaît. So now, of course, I may have to place a Malleus prosthesis, we'll see. Plus a torque. Again, some adherence there. Ciseaux. Okay. All right. Okay, so now I need to work on the oval window to identify the full plate. Or making if there is some fibrous tissue, I try to make a gap within the fibrous tissue. Mais c'est parti en bas là, s'il vous plaît. In order to introduce the distal tip of the shaft, holding it. Okay. All right. There's no question of landmark. We have the promontory on the right, and we have, you can see the facial nerve here. This is the adhesive band that I cut. Trois de chouk. Un 9, s'il vous plaît. I like to use a macro hook for this kind of things. Yeah. Here is the foot plate. And I need to know if it's fixed or not. Okay, I'll check it now. I'm going to check it now, and it's fixed. Yeah, it's a fixed full plate. So it will be a second stage then. Because it's too inflammatory. If I put a Malleus prosthesis, I think we need to stage. Calmez, s'il vous plaît. So tympanosclerotic stapes, ankylosis, I think it's more tympanosclerosis here. You see, it's pure white. Okay. Ok, good. Bon ben, je crois qu'on va devoir mettre une prothèse marteau, c'est tout pour l'instant. So if I put a Malleus prosthesis plaron, I think I need to take a piece of cartilage because I think the one which was used is not really good. Yeah, 3 de chouk s'il vous plaît encore.
Avec une douzaine?
Ouais.
On la sort la prothèse marteau.
Oui, oui, allez-y, allez-y.
Prothèse marteau.
So I will place it here. Here. And then, okay, so first I need to take a piece of cartilage. Calmly. So I will reposition the flap temporarily in order to go back to the tragus. Because I took only the perichondrium, and that's not enough with titanium prosthesis, especially with this atrophic area. I thought we could find some cartilage, but it's several. It seems that the previous surgeon was using several part of cartilage, which was placed together, but it's not working well. So this, I need to reinforce this area with both cartilage and perichondrium. Voilà, on peut interrompre. So we're going to stop the recording for some minutes. We're going to take the cartilage. On peut interrompre 2 minutes. Alright, so now I need to trim the cartilage. So I don't remove it, I try to trim it from the inside. And then if necessary, I will retrim it from the outside. But very often I can make a thin one, like a thin layer of cartilage. If I follow the... I may have to trim it, but it's gonna be fine, I think. Okay, this is good enough. So I can keep this line for the shape of the pince, okay? But I need to trim it a little bit more. You use cartilage trimmer? You have a cartilage trimmer? Yeah. But it needs to be trimmed, because you know some surgeons don't trim it and it's not good because it's too thick.
It's always thick.
Yeah.
I usually take it out because it's easy, but
Sure,
the
no,
microscope
for sure.
It's a great idea. Definitely. I haven't seen anyone trimming it before. It's brilliant.
It's quite nice to do it. Sometimes you can do it once, but if you have to retrim it a little bit, it's fine. Because I don't need a large one here also. It's just to cover the titanium Malleus prosthesis. Vous voulez changer la lame? Vous l'avez changé ou pas? Non. Bah, il faudrait mieux parce qu'elle est un peu jeune.
Good magnification in the microscope is very good.
Yes.
Try this.
Well, it's good. Because I mean, but the cartilage trimmer is fine too, I think. But I prefer to. I like to do it myself with this.
And
But
you
it's
always leave the other part there.
yes.
Not general.
Becoming better now. Of course, it's too thick, too large. maybe I don't need a perichondrium. It's not. I see. I like to do it like this. 'Cause I really control what I can do according to the different size of the.
You can feel the blade on the other side.
Yes, yeah. I can feel it with my finger. Yeah, sure. And sometimes you make it thinner, but it's not a problem because the whole thing is better now. So we need to have it. I don't like when it's too thick because it's impairing the mobility of the tympanic membrane. And I've seen many cases where I was revising cases where the previous surgeon was using cartilage interposition and didn't even trim it, and it was so thick. And it's not so easy then to remove it when you revise, because it sticks to the.
Sticking to everything to prosthesis.
Yes. And if you keep a little bit of some connective tissue from the lateral side, you can exactly know the limit of the trimming. Becoming soft, so this I can remove. And cut my finger or something. Right, okay. I think I need to trim on the other side also a little bit. It's becoming really much more flexible now.
It doesn't curl either.
Sorry?
It doesn't curl inside, sometimes it just
No.
curls inside.
Okay, looks good I think now, eh? We have a hole there in the middle, but it's not a problem. It's going to cover the whole thing. Alright, let's see what I can do with this. I will remove this, I think. That would be enough. Okay. Okay, we're going to see to try if I can place it like this. I think it's going to be too large, but we will see.
It's better large because you can cut it.
Sure, of course. Ok. On peut fermer le. On peut arrêter. On peut arrêter l'enregistrement, s'il vous plaît. Okay, we made the recording in pause and be back for the. Okay, so I will first try to place the perichondrium graft, just mainly to reinforce the drum at the posterior superior part of the drum because it was pretty atrophic. So this is just for the tympanic membrane, but it's not enough for the titanium prosthesis, of course. We need to use cartilage. Okay, looks good. I will now stick it to the tympanic membrane, and it's gonna be fine. Okay, that is good. Now the other window is on the right, so I need to have a handle coming there. I hope it's going to be enough. I think so. I think it will. So I think I will need one here and one on the other side. Ok. Allez, la prothèse marteau. It's a really nice one. I like it when we did it. It was a very nice design. The Uwe Steinhardt, the engineer of Quartz at that time, now he's in Medell, but before he was in Quartz, and we worked together, and it was very, very nice.
It's very stable.
Yeah, exactly. So I know that I'm going to make a first hole here, because I need to avoid the facial nerve, of course, so it will be here, and then I will decide for the second one. Okay. Allez, ouais. Non, c'est pas ça, c'est l'autre. Hein? Okay, so using 0.4 millimeter, 0.6 millimeter, 0.4 millimeter. No, it's a 0.6. Sorry, 0.6 millimeter burr. Ok, un peu de sérum s'il vous plaît. Pretty thick bone, eh? There we go, now it's fine. Cannez s'il vous plaît. So have a hole, eh? Completely whole here, so it's fine. Now we need to decide for the second one, which will be, I need to place it closer to this. Otherwise the handle will be too short, so I need to decide for the position. Yeah, that's it. Now we need to place it here. I need to make it here. Very narrow, to do. Yeah, I try to find the right way to expose it better. Ah, bien, tu vas pas là. I can see a little bit, so let's see. And this is more easy because it's a soft bone. Not easy. I need to make it closer to the... Okay, un peu de sérum s'il vous plaît. That's better now. There we go. It's not, I think it's a little bit close, so I need to probably reduce the distance between the two hooks. Yeah, definitely I will have to. Okay, la pince s'il vous plaît. Okay, I remove it and reduce the distance between the two hooks. That's better now. Pince s'il vous plaît. Okay, see, it's easy, eh? It's a nice way to reshape it. It was very nice. Okay, maybe a little bit too much, we'll see. This can be readapted from the inside. Okay. It's not easy because of the gap, huh? I need to turn it first. The first hook will go there. It's very narrow because I use both instruments. It's not working. Plafond. I think I'm in. Yes. There we go. And that's it. Okay. All right, I think it's fine. So let's see how it works with the over window. I think it's long enough. Bravo, s'il vous plaît. Ou plutôt, oui, ça ira. On va prendre un 9 là. Hein. Okay, it's long enough. You see, it's over the over window. We'll see better in a minute, but because if I remove the blood, we'll be able to see it. Yeah, the over window is there. You see the foot plate there down. So I will move a little bit anterior, and it will be fine enough. So then, second step, I will do stapedotomy and do a Malleus to stapedotomy procedure.
How long would you leave it?
6 months. 6 months is better. No, 3 is not long enough.
We have a lot of scarring.
Yeah, sure. Because you know, this will be fixed. At the moment, it's still too much mobile, a little bit loose. But after 6 months, it will refix to the bone, and it will be fine. So okay, the cartilage maintenant, s'il vous plaît. So of course, I put the cartilage now. I don't need a big one. It's already okay. I think that's all I need. I can try even with this one, but I will definitely use this. So, okay. Ah, it's coming well.
Looks like I did this before.
I think sometimes. Yeah, fits well. Okay, good. Well, you never know, eh? Because sometimes you size it and it's too short or too long, then you have to resizing it. You have to resize it. Okay, I think it's fine. Claron. Claron. So it looks good. So now we wait. Yeah, it's really good. Even better view now of the anterior angle. And that will be for the second stage, will be helping me a lot. And I will put a middle cell. Okay. Oui, je suis pas sûr. Oui, peut-être quand même. Allez-y. Attendez, hein. Attendez. Allez-y. Merci. Okay. Good case. All right, so the next one will be